One of the main reasons why I wanted to become a physician, I think, and largely most physicians, is really to help people. And I think it's gotten deeper than that as I've gotten more into my career, and actually I think it comes down to really affecting change in people's lives. There's so much more to medicine than the nuances of science, and I think that getting to know people, getting to know their families, getting to affect change in their lives, how they carry their lives, and kind of have snapshots throughout each patient encounter of like a whole timeline of stories is really why I have really grown to love being a physician, really love what I do, and hope to continue that moving forward. The most rewarding part about being a doctor is really some of the little things, and finding those little changes that I can affect in a patient's life, from health literacy, education on their disease processes. And I think those are kind of the things as a general internist that I really, really do cherish and really make for a well-rounded experience for myself and my patients. The one question that I wish my patients asked me more was, what can they do to empower themselves in understanding their diseases? I think often, and rightfully so, patients should rely on physicians. And I think that there's a lot of information out there on various, through the internet and various sources that are very helpful. But I wish sometimes patients ask me more, how do I get through some of this information? How do I empower myself to take what you tell me and also translate that into a way that is digestible for me in my home life, and how to actually implement those things? Because often there's a lot of information, a lot of knowledge out there, and I think that if patients are able to empower themselves and figure out how to do that, I think that goes a long way into improving their understanding of disease and their overall health, and improving their health, and ultimately improving the physician-patient relationship. So that's what I wish patients would ask me more. I am Dr. Kenneth Lau. My mission at Jefferson is to improve lives.